Hello, I'm Shawn, President and CEO of the Shepherd's Care Foundation. This has been an unprecedented time for all of us, especially in healthcare. I'm reaching out to provide an update to our residents, their loved ones, and our dedicated staff and volunteers on how Shepherd's Care is managing during this crisis. The health and safety of residents and our staff is our number one priority. We have convened an emergency operations center which meets every morning, 7 days a week, to ensure that we're acting on the most and current information. Further, our clinical and site managers meet every afternoon to review daily events, ensure consistent information sharing, and address any issues that arise in real time. We understand the care entrusted to us for our residents and the risk of COVID-19 poses to them. Now is a time for vigilance and caution, but also we must remain calm and trust in our health professionals and in God's guidance. Our operating response is always to be several steps ahead of the curve. We have taken a number of swift and aggressive measures to protect the health and well-being of our residents and staff. First, building from the direction of Dr. Dina Hinshaw, Chief Medical Officer of Health, we have limited gatherings to 10 people or less. This applies to both staff and residents. I have personally canceled all visits and I am speaking to you right now from my home office. As a result of these restrictions, much of our resident programming has been canceled or redesigned to be delivered in smaller groups or one-on-one. Hairdressing services have also been canceled. We are working with our meal delivery partners to increase seating so that we can limit the numbers in our dining rooms and our restaurants at Kensington Village Wellness Center and Heritage Market Grill, which are effective Tuesday, March 24th, 2020, to delivery only. Second, social visits, group visits, or visits by children under 18 are not permitted with our residents. Only in rare cases are designated essential visitors permitted, and those must be providing direct resident care or end-of-life care only. This is at the discretion of our site managers without exception. You'll see enhanced security and reduced entry points at all of our facilities. This is to protect our residents. We understand the importance of communicating with your loved ones, especially now, and we've made resources available so that you can communicate by phone, FaceTime, or Skype. Our staff has access to iPads and appropriate training and help to use the technology to support communications between you and your loved ones. Third, we have reduced movement within our campuses, including independent residents who can no longer access common areas. COVID-19 can cause serious respiratory illness. Because it is a new virus with no treatment or immunity in people, it is critical to reduce person-to-person contact as much as possible and to practice social distancing. Finally, I want to let you know that we've had 2 positive COVID-19 cases at our independent living facility at Kensington. Both individuals are in self-isolation, receiving care and meal service from our staff. We are cooperating with health authorities and taking every precaution. While this is not news we wanted to hear, it is not unexpected. My team and I have been preparing for this situation for weeks, and we have quickly responded by establishing protocols to manage this situation. This includes staff communication, sourcing and usage of personal protective equipment, and containment through isolation. Further, all the individuals who may have been in contact with one of the 2 residents have been notified and are currently in self-isolation. Shepherd's Care Foundation, with the support of Alberta Health Services Public Health, has placed the entire Kensington campus of care on respiratory outbreak protocol. This means that no visitors will be allowed and no residents will be permitted to leave the property. I want to stress how critical it is that we remain calm and understand that Shepherd's Care Foundation is extremely well prepared for this situation. I also want to remind you that the best defense against the spread of COVID-19 and other airborne viruses are actions that each of us are empowered to take. Practice social distancing, self-quarantine when symptoms of respiratory illness and any illness are present. Wash your hands regularly and thoroughly. Avoid touching your face, always cough into your sleeve, stay home if you're sick, and get an annual flu shot. I want to acknowledge the hard work of our dedicated frontline staff during this crisis, our healthcare aides, our nurses, our therapeutic staff, and our chaplains. Shepherd's Care understands the importance of celebrating and honoring the whole individual, physical, emotional, and spiritual. Both our clinical and our pastoral care teams are going above and beyond to ensure our residents are safe, cared for, and loved. Some of these measures may seem extreme, and I'll get that. But I would much rather take steps now that go too far than to have to apologize for not doing enough. Corinthians 15:58 says, "Therefore, my dear brothers and sisters, stand firm. Let nothing move you. Always give yourselves fully to the work of the Lord, because you know that your labor in the Lord is not in vain." We're doing everything we can to stand firm and do the right thing for our residents, staff, and others. Thank you for your prayers. If you have any other questions, our website, shepherdscare.org, is updated daily with COVID information and has an FAQ. You can also reach us at shepherdscare.org. Thank you, and God bless everyone.